Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Good Thursday morning to you. I'm Jim Stallings along with Kay Murray. Good morning, Kay.
Morning, James.
And welcome back to Andrea McCarty. She's Mon General's diabetes educator. Good morning.
Good morning.
And today, in part, we're going to be talking about prevention of
Correct.
type 2 diabetes. So I'm going to say, don't become sedentary and overweight.
That is one good way to prevent type 2 diabetes.
Is that the
Jim.
main way?
It's one of many, yes. It does all kind of fall around weight, managing weight, making behavior changes, such as being more active and eating healthy.
A majority, and this used to be really called adult onset diabetes, but I know that people under the age of 18 can get type 2 diabetes as well. But for the adult onset diabetes, I used to just compare that to people who have a spare tire around their middle. I mean, a lot of men, such as myself, develop the spare tire in sedentary lifestyles.
Yes, and people that are shaped more, as you say, the spare tire, more the apple shape or round in the middle, they are more prone to diabetes. Physical activity that can combat that can help prevent diabetes, but also what you eat and how much you eat can prevent the weight gain.
Yeah, so why is it that having that apple or pear shape or having that in the middle, the fat in the middle, means that you don't have enough of a certain chemical being produced in your body?
Really what it means is insulin resistance is something that goes on in your body when all the insulin you make, not all of it works the way it should. So the pancreas, the organ that makes insulin, will make additional insulin to help lower blood glucose. So you have additional insulin circulating in the body. When there's extra insulin circulating in the body, that insulin promotes fat storage, primarily in the central part of the body. So typically when you're apple-shaped, it's a sign of insulin resistance, which is a precursor or usually comes before diabetes.
Something I'm hearing from people more now than ever is so-and-so is diagnosed with pre-diabetes. So now they're eating right and they're exercising. They're trying to ward off actually getting diabetes. So what is the definition of pre-diabetes?
That's a good question. Some people know pre-diabetes as borderline diabetes, but the correct term actually is pre-diabetes. When you have a fasting glucose test done through a lab, less than 100 is normal, but the result has to be 126 and higher on 2 separate occasions to diagnose diabetes. So the window of a blood glucose from 100 to 125, that becomes prediabetes. So in other words, glucose is higher than normal, but it's not high enough to diagnose diabetes quite yet. So prediabetes is reversible. It's very important that people understand that. Prediabetes is reversible with behavior change. Diabetes is not a reversible condition.
All right, behavior change is very difficult for anybody. And so what type of behaviors do we need to change if we get those 2 readings that are above 126?
Once you have 2 readings above 126, you actually would have diabetes, and we would look at diabetes treatment. The main things we focus on: medication if it's recommended at that time, meal planning, and we look at carbohydrate in the diet. Carbohydrate is an essential part of a healthy diet, but the goal is to get the same amount of carbohydrate at each of 3 meals. And also physical activity. Physical activity does tend to bring your blood glucose down. Now, if you're looking at somebody that has a glucose in the pre-diabetes range, the goals are to decrease the fat in the diet and increase physical activity up to 150 minutes per week.
What are the common foods that we eat that are high in carbohydrates?
In all honesty, most of the food available to us has carbohydrate in it. There are very few food groups that have no carbs. Mainly fat group like cream cheese, butter, mayonnaise, salad dressings, very little to no carbs. And protein sources like eggs and cheese and meat, fish, very little to no carbs. Fruits have carbs, fruit juice has carbs, yogurt and milk, all starches and starchy vegetables. Vegetables have it. Sweets have it. Most of the food out there is going to have some form of carbohydrate in it.
All right. So you said for your 3 meals, having the same amount of carbohydrates in each meal?
Right, right. And, the average man probably needs roughly 60 grams of carbohydrate per meal. And some people will decrease it down to 60 per day, which is not recommended for a healthy diet. Average male, about 60 grams per meal. Female, around 45 grams per meal. Now, we do that individually when we see patients to really come up with the right amount for each person. That 45 or 60 might be a little high or a little low, depending on the person, but that's a rough estimate.
Are highly processed foods bad, like the wheat bread, or I don't want to say wheat bread, white bread, and I always think of the white foods when I think of maybe diabetics should avoid potatoes and bread and white foods like that. I don't know if it's probably too simplistic to say white foods because that probably excludes something that is good for you.
Right. Well, one of the things when we teach patients meal planning for diabetes, because diabetes is a condition you're going to have for a lifetime, we want to give you meal planning tips you can follow for a lifetime. So we don't exclude any single food out there. The only foods we may tell a patient to stay away from would be if they have a food allergy. Then obviously we're going to say stay away from the ones you're allergic to. But there are stories or people that try, I won't do anything white, no white flour, no white pasta, no white sugar. That's a choice. It's not something we recommend because, then what happens when Thanksgiving comes and you're at grandma's and she has mashed potatoes? Do you want to restrict yourself and not have that, or do you want to know how to have that in a responsible way, which is what we like to teach people how
Well,
to do.
it is choices. And honestly, I guess if we choose to say no to mashed potatoes, we can do that. I guess it's not going to harm much. But I mean, I've had to learn, I'm trying still to learn when they put donuts and cookies and things out here by the coffee machine, other employees here, to walk by it, learn to walk by it. Well, obviously the glaze on a donut's not going to be any good for a diabetic.
Well, I mean, the thing is, somebody with diabetes can eat donuts. The challenge is how many carbohydrates are in a donut. And in one donut, you're going to get about 30 grams of carbohydrate. So if you want to have one donut for breakfast, you can do that, but you still need a little bit more carbohydrate to add to that. You don't want to have 3 donuts for breakfast. You don't want to do that at every meal, and you don't want to do that every day. That's the dietitian coming out in me. It's not a healthy choice, but it is okay to do that once in a while.
I think that obviously when you develop the spare tire or the pear or apple shape, smaller portions are a good way to go too, because I think especially in our society, we are just programmed and brought up to eat everything on your plate or you don't get the reward.
You're exactly right. And we may have talked about that one other time when I've been here. Most of us are raised to clean our plate, so we lose that ability to notice when we're no longer hungry. We determine how hungry we are based on what food is left on our plate. One of the first goals is use a smaller, not a teeny tiny child's plate, but use a smaller plate, fill it up once, and don't go back for seconds unless your stomach is telling you you're hungry. If it's just your mind saying, wow, that meat was really good, or I really want some more stuffing, don't feed your mind, feed your stomach. And that's something most of us have lost the ability to do. As
we plan our meals and getting that number of carbohydrates that are right for each meal, should we be counting the carbs of every meal that we eat? Is that the first thing we should count, or we should be counting something else?
Counting the carbs. For diabetes, counting the carbs is the first thing we like you to do. But it does become easier. It's tedious the first week, I'll be honest. It takes time and effort and planning. But as adults, in a 2-week time frame, you're going to find most adults eat the same things over and over and over again in every 2 weeks. So if you've done it for 1 to 2 weeks, by the time you have that meal or item again, you can remember how many carbohydrates were in it or what the portion size should be.
If you have any questions about diabetes or pre-diabetes, pick up the phone and give us a call at 304-296-0041. This is Health Talk, brought to you by Mon General Hospital.
This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
We're talking about diabetes today, type 2 diabetes, and also early onset diabetes, but it's pre-diabetes now. And again, if you get between 100 and 126 on your glucose reading 2 separate times, that may be pre-diabetes, but over 126 2 separate times is diabetes.
Correct.
All right. So, and again, we've come a long way when it comes to testing your sugar. I mean, it's usually just a little tiny lancet that makes a tiny little hole. And really, in my case, I have trouble getting blood coming out of it. I mean, that maybe I'm just coagulated all the way through. But
just a quick question about that, if I could. And we had a multiphasic done last week. And will we be able to be determining from that test if we are pre-diabetic?
Usually multiphasic will include a fasting glucose on it. So, yeah, I would say you could.
Yeah, if you fasted, it's more than likely you had what's called the A1C.
On a multiphasic, it would be just the glucose. A1C is usually not ordered unless you already have diabetes or they're suspicious of diabetes or prediabetes.
But that's really the reason why the fasting is done in a multiphasic, is so that you don't have foods in your body that will elevate levels artificially.
Correct.
Okay. And so look forward to those results. When do they come, Kay?
They should be here in about a week or so. But the next test after that, if we see we have an elevation, what do we do at that point?
If it's elevated to the prediabetes range, there are several options that you have available to you. Behavior change is recommended. I think I'd mentioned before, 150 minutes a week of exercise would be the goal. If you're not active at all, you want to work up toward that slowly. It could eventually just be 30 minutes a day, 5 days a week. And then you want to watch the diet, avoid skipping meals, have about the same amount of carbohydrate per meal, and watch the fat content in the diet. You want to go more toward a low-fat diet, and that's more to cut calories to promote weight loss.
What I wanted to do, to follow up from my question, do I call my doctor if it's slightly elevated? What is the point where I say, ooh, I better call my physician?
If it's slightly elevated and you're questioning it at all, I would definitely
Check it
recommend
out.
call your healthcare provider, yes.
Then will he go a step beyond and take me in for a full glucose test? Or
Well, typically, years ago, we used to use that oral glucose tolerance test, that 3-hour test to diagnose diabetes. That's only used to diagnose gestational diabetes anymore. So basically, with just that one result on the multiphasic, they can make some decisions from there. If it's elevated and that's just your first elevated reading, they may order a second test, just again, another fasting glucose test.
All right, so we talked about diet and limiting those carbohydrates and really sensible eating. And I think that there are classes for that. You certainly have nutritional classes to help people along, because I think a lot of us think we can do it on our own, but we need some professionals to guide us along, I think.
All the research does show that with support, you're going to have more success in making behavior changes. And in all honesty, that's what we do out of the Diabetes Learning Center at Mon General. We do have a dietitian that meets with patients individually, and we also have diabetes education that can happen either in a group or individually. What we do in those sessions, let me say what we do not do. We do not give you a list of foods, eat this and don't eat that. We do not discipline you for making poor choices. Our job is to work with you and tell you, these are some things that might help. Now you tell us, what do you want to do? And we help coach you along. So we're not, the technical food police or the dictator telling you what you have to do. We want to work with you and give you the support you need to make behavior changes. Because starting to exercise is hard. Changing your diet is hard. We're there to help give you suggestions.
But this is not going on a diet.
Correct. You are exactly right. It is not going on a diet. It's a matter of looking at food differently and looking at food in a way that is going to help you and not hurt you.
Let's go to the phones. John has a question for you. Hi, John. You're on with Andrea McCarty.
Yes, I've actually got two questions, but the first one, she was talking about the same number of carbs each meal. But let's say given a situation where you're not very hungry, and for lunch you eat a sandwich that's with 2 slices of bread, maybe has 35 carbs in it, and you're on insulin. If you take what you've been recommended for each meal, like 10 units, you may wind up with a sugar low. And my question is, do you add some extra carbs and take the regular amount of insulin, or should you cut down the insulin?
To be honest, John, both of those will work. What I recommend is if you're having to eat extra food to prevent a low because of your insulin dose, then it is more important to cut the insulin dose. Then you're taking too much insulin if you're a high risk for low in that case. One of the things you may be able to work with your healthcare provider on is adjusting that insulin dose or teaching you how to adjust the insulin dose based on how much food you eat. If you're on mealtime insulin, that is something that you can do. So that might be of help. And the other idea is where you're getting 30 to 35 grams of carbohydrate from that sandwich, 15 grapes, for example, would add another 15 grams of carbohydrate to that meal, and that would get you to 45. That's a small addition, but if you don't want to eat the food, then I really think the insulin dose needs to be adjusted.
Okay, now, based on 10 units for the normal carbohydrate intake, if you were going to adjust that down, I know it's individually sensitive, but in my case, is that 1 unit for 15 carbs or 2 units or?
Well, and we really can't figure that out in this setting. That's something I would encourage you to talk to your health care provider about. I have seen patients that need 1 unit of insulin for 4 grams of carbohydrate. I've seen patients that need 1 unit of insulin for 60 grams of carbohydrate. So it's variable.
Because I think when your healthcare provider sets the amount of insulin that you take, I mean, he's working with you as an individual to determine what's right for you.
Correct.
Yeah.
Correct.
So.
Okay, I had one other question.
Okay.
If your glucose is low before mealtime, do you take your insulin before eating or after eating?
What type of insulin are you on, John? Do you know the name of the
Humalog.
insulin? Humalog. That is one of those mealtime insulins that can be taken 15 minutes before the meal, anytime during the meal, and up to 15 to 20 minutes after the meal for the same effectiveness. So if your blood sugar is low, and let's say you sit down to eat the meal and you've taken your insulin before, but you get pulled away by a phone call or something and you don't finish the meal, you're in real trouble because that sugar could drop. In that case, I would recommend taking that insulin right after you eat. The effectiveness would be the same, and that way you can ensure that you've eaten the full meal. But you do need that insulin to cover the food. If you don't take it, then your sugar's likely to go up
So it is
eating.
okay to take it after you eat?
For the Humalog or another brand called Novolog, yes. And Apidra as well as another brand.
All right. Anything else, John?
No, that's it. Thank you very much.
Thanks
Thank
for
you.
calling.
But what this tells us is you really do need to work closely with your doctor.
Right, right. And, you know, on the education end, we can help teach patients how to make those adjustments with direction from their physician. We teach them how to do it if the physician has already told us what they want them to do.
Good luck, John.
And we invite more phone calls. We have time for another call or two in the next segment. You're listening to Health Talk on WAJR.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
Andrea McCarty is a diabetes education coordinator at Mon General Hospital. So you also counsel people on making that first step and getting some exercise. You probably counsel people every day. We have mental roadblocks that keep us from doing it. It's raining, it's cold, it's windy, I don't have a good place to walk. But how do we start?
Well, first thing I like to recommend patients do is look at the barriers to why they're not exercising. Now, we do have some patients, when we see them, they're already physically active. But look at the barriers to why you don't exercise now. And I'll be honest, there are 2 most popular answers to that question: time and tired. And you might be tired because your sugar is high, because that is a symptom of a higher sugar. And time, we're always going to find time to do things we want to do. No matter what they are, we will find time to do what we want. So you've got to pick an exercise you want to do, that you will enjoy, that you will find some pleasure in. It may not be the standard just taking a walk, but find something that is interesting to you.
So maybe that time you devote to Jerry Springer every day, you make an appointment, that's the time I'm going to put on my shoes and step out the door and start walking.
Either that or put a treadmill in front of the TV and still watch your Jerry Springer, but the rule becomes I have to walk if I'm going to watch it.
Now, if people want more education on diabetes, or perhaps they're worried about their pre-diabetes diagnosis, can we start seeing you or going to Mon General and start getting some education?
Sure. Basically, the service that we provide is billed to insurance, and most every insurance does cover it, but we do contact insurance to verify so the patient would know ahead of time their coverage. And we see patients individually and in a group. If anybody is interested in seeing us, they can just call the office, give us their name, date of birth, and their physician's name, and we'll contact the physician to get the referral and take care of the rest.
Andrea, thank you so much for the information this morning. Andrea McCarty. And again, this has been Health Talk, brought to you by Mon General Hospital. This show comes your way each Thursday morning at 8:35. Stay tuned for Morgan 10 a.m., the talk of the town, coming up after the news on WAJR.